We're going to give it just a few minutes and give it a few shares. Hey, good morning. If you're just tuning in, we're going to get started in just a few minutes. Do say hello. Hi, Daryl. Let us know that you are here. And if you feel like it, go ahead and give it a share and let other folks know you're watching. We'd love to have them watch with us. We'll get started in just a couple minutes. All right. Hi, Sally. All right, we'll go ahead and get started. Good morning, everybody. If you're joining us for the first time, I'm Kim Baker with the Gallatin Chamber of Commerce, and we are bringing you the C Show. We've been bringing you the C Show live on Facebook here for several weeks now. The Chamber exists to support, educate, and engage our member businesses, which is why we have the C Show. Today, we're joined by a very special guest, Hal Hendricks, a friend of mine and the Executive Director of the Sumner County Health Department. Welcome, Hal.
Good morning.
Good morning. I think this is the first time you've joined us on our show, and I know that you have had a very busy last few weeks, even months now. Tell us, has it been indeed busy, and what does your world look like?
This is a new world for everyone, particularly for public health, but this falls right in line with what we do with our surveillance and our immunization program. So, I couldn't be more proud of my staff. They've pulled up their bootstraps and just went to work, and we've done a great job of educating the public and protecting the public and doing our testing. We're doing testing every day, 9 to 3. They can call the clinic beforehand to make an appointment. Go ahead and get us their paperwork in, and then pull into the back of the building. Pull up to one of the signs down there, call in, and our nurse comes out, does the testing swab, and away you go. 48 hours or so later, we'll give you a call with your results.
Awesome. And now that's the testing for COVID. We've heard a little bit lately about the antibody testing. Is that something that you can have done at the health department, or do you know of other locations in the area?
No, that's still in the works statewide, nationwide. I did see on the news last night there was somewhere around 130 some odd antibody tests. Some of those are questionable. Some of those are not reputable, not FDA approved and licensed, so we just need to be patient with those to come through and see which way the state wants to proceed.
Got it. I think I think today we'll talk a lot about getting back to school and back to business and some things that'll be expected and just kind of what you're looking at. But we did have a question that we'll go ahead and maybe address right now so we can talk about this real quick. Daryl Rogers says, seems as though Sumner County's numbers are still rising. Let's talk about that and talk about those numbers for those folks that maybe aren't watching those daily updates and keeping up with that data.
Yeah, we still have some positives out there. The virus is still here. It's still in among the public. We need to continue the social distancing, again, washing our hands throughout the day, and wearing a mask. The studies show that the masks do help protect both the public and the individual wearing the mask. So I highly encourage individuals to do so. And the masks are available through the drive-through at the across from the chamber right there at the city hall. Also, the health department and the electric department, the drive-through electric department.
And I think the masks you're referring to are the ones that were issued by the state, right?
Yeah, right. The little black mask with the TN in the corner.
Yeah, they're they have the TN on them.
Yes.
And so they're pretty thick, and you can tie them yourself. So, if they tie around your head. So if you've had some of those that have given you a headache or pulled on your ears, these don't do that. So they're interesting and they're nice and they are available, and there's no limit, correct? You just kind of tell them how many.
Right. How many in the family you need. And we strongly encourage individuals to wear their mask in public, in and out of the stores, when they're shopping and among individuals. And, it's a smart thing to do at this stage. Our numbers are better, but we're not where we want to be. So let's continue to be aware of social distancing, washing our hands, and wearing our mask, and keeping away from those that are the vulnerable population, the elderly, and those with immunization compromised.
So let's talk a little about yesterday. I know on social media and some different news sources, we started to see some guidelines released by the CDC for opening schools back up. Not necessarily talking about those guidelines, but as we prepare to kind of look towards the summer and prepare for the next school year, what should folks be doing to prepare for that, and what does that look like for your office and just some different organizations in the community?
From around June 15th until after school starts is one of our busiest seasons. Immunization, which is tried and true old public health, getting the kids' shots updated. One of the issues we're going to have this year is traditionally in the last of April, the school system has a kindergarten registration for the next year. We're not able to have that this year. So we'll have lots of incoming kindergartners, first graders who have not gotten their documentation and paperwork, gotten their shots, received their school physicals. We really encourage parents, don't wait until the last day of July and then realize, oh, my child needs immunizations and my child needs the school physical to start school next week. We're really trying to go ahead and emphasize contacting the health department. Let us go ahead and start that paperwork, or contact your provider early, as soon as possible. Generally, what happens is all the pediatricians their appointments get slammed and get filled and they're backlogged. And then the parents wait to the very last minute to come in to see us, and we try to do our best to get them in and get them out. So it's something that we always try to encourage parents to think ahead, get them done today or as soon as possible, and you're ready to go. And that's one less headache, one less issue. School's going to be a little hectic getting started this fall. A lot of questions, a lot of possibly new procedures and new policies. So this is one less thing we're encouraging parents to go ahead and mark off the list, so you don't have to worry about it this just late July, August.
I think that's a great tip. I know that usually it is always kind of backed up at the end of the year, and I can imagine this year it'll even be more so. So we'll be thinking about you and your team and all of our providers in the area. And so if and Hal's phone number is scrolling at the bottom, and I'll put the link for the Sumner County Health Department in the comments as well. And then also I will mention that if you are in the area and you're looking for a provider, the Gallatin Chamber is happy to help you make some suggestions. We have a directory on our website. So going back to school and these guidelines, tell us a little bit about what your relationship is with the Sumner County school system. Do you get involved in their processes being, within the county and the district, or how does that work?
Yeah, well, we usually meet with the director of nursing for the school system each year, and can look at their calendar, look at the dates, see what changes they've got in store. Over the past few years, it's the rising sixth graders that are going to be into seventh grade getting their Tdap and varicella shot. That was a new immunizations that was put in place about 4 to 5 years ago. We hopefully we've seen less and less of those each year. We'll have a few sixth graders that are going to be seventh graders that have not received either the Tdap or the varicella. That's the second or third little group that we see number wise. Is, of course, the kindergartners coming in. And then secondly, it's the transfers. That'll be interesting to see how many new parents for new kids to Sumner County schools from outside of the county coming in, getting their shot records filled out and completed for Sumner County, outside the state and or outside of the county, getting them introduced to Sumner County schools. And the third little group is that rising sixth graders to seventh grade with a Tdap and varicella. Those are the three groups that we work primarily with. The other one is high school seniors who have graduated, who are now going off to college this fall. That's going to be a whole different ballgame with shots that are required by the Tennessee school system, the higher education system, even out of state. And I encourage, if you've got a senior, if you know of a senior who just graduated, that's going to be going off to the college, they need to be checking with their school where they're going this fall. Let's go ahead and get them signed up, get those completed, because that's another group that comes in and says, I'm leaving for college tomorrow and I need to get my shot. What shot do I need? Well, they need to bring that information to us, because it varies from school to schools, particularly out-of-state schools. We generally know that the school system, the Knoxville, MTSU, TSU, UT Martin, Tennessee Tech, Ball State, that system we know, but it's the smaller schools and some out-of-state schools that we're not familiar with. So we suggest that they go ahead and contact the school, find out what shots they're going to need to start school this fall in college, and we'll go ahead and get them taken care of.
Good to know. Daryl just posted another comment. I don't know if we can answer this, if you can answer this yet, but it says, has the CDC made recommendations on what parents should expect when getting kids ready for school?
Yes, there's some new ones that I was just looking at that just came out. It's on the CDC recommendations and it goes anything from ball leagues to school to there was a load of information I was just perusing through that had just come through on an email this morning. So the best thing to do is go to the CDC website, look it up, and if you have any questions or concerns, call the health department, and we'll be happy to follow up or get you an answer, a clearer answer in case there's a gray area somewhere.
And I think it's safe to assume that the Sumner County Schools District will, and then any other private schools within our area will probably be pushing out their own guidelines and letting us know kind of what they plan to do in regards to those guidelines.
Yeah, Jeremy Johnson and Lisa Heron, who's over the school nurses. I'm sure that they're meeting, and we've been talking and trying to get communicate between each department and make sure we're all ready for the fall. And they're waiting to hear the governor and the CDC, Department of Ed, getting out information. So there's a long chain of information coming down. It just takes us a while to decipher it and get it out to the public. So people should be patient right now. But it's been released and we're moving forward. So again, the CDC website, tn.gov, the governor's website, the Department of Health website, Department of Ed website would be beneficial and give you the latest details, along with the Sumner County schools.
Perfect. And if you're not following all of those on social media, you really should be. They're posting great updates. Sumner County Schools has been really great during this time to post updates on what's going on, as has been the Department of Education and Department of Health for the state. And the Sumner County Health Department does not have their own social media, correct? You just kind of
correct.
Is that right?
SumnerTN.org. And then you go to the health department. We've got a frequently asked questions drop down box there that you can go to. And then Also, if you're new to Sumner County, new to schools, we have an immunization uh, access portal there that you can put your information in. We'll look up in the tennis, which is the immunization uh, program, and make sure your child is all up to date on their shots. So we've got access that way. That way you don't have to come in, and we can even have your shots all ready to go. Last year we did about close to 200 of those forms, and individuals didn't have to come into the health department. We got them completed. Um, they were signed and sent in by the through the website, and then we went ahead and forwarded them to the schools and back to the parents, and that was completed. So that was a benefit, quick and easy, complete, done, ready to go to school.
Awesome. Let's talk for a minute pre-COVID and then just normal operations at the health department, which y'all are still doing during this time, which is, I think, quite impressive that, aside from everything else, in addition to everything else, just business as usual is still going on. What programs and services, especially for those who are watching who maybe have no idea what the health department offers to our community and how many locations there are within Sumner County, share a little bit about that and just some of the resources available.
Right. The Tennessee Department of Health, the health department, Sumner County Health Department is the local on the ground department of the Tennessee Department of Health. We take care of uninsured and underinsured, and we do primary care for individuals that are not insured. We're the gatekeepers for TennCare. We also, one of our big programs is WIC, Women, Infant, and Children Supplemental Food Program. That's really changed in the last 8 weeks. Where we used to do a one-on-one face visit. Now the individuals are calling, and we're doing a phone visit, and that food packet is downloaded electronically onto their WIC cards. That's a big change in the last 8 to 10 weeks. We're also just doing a little bit of the FaceTime slash what they call it. Slipped my brain. On camera. I call it on camera visitation with patients. But those are just 2 or 3 of the small programs that we do here at the health department. We have a COPO program here at the health department. We also do breast and cervical, a federal surveillance program. And again, the old-fashioned public health with communicable diseases is one of our programs. We are Gallatin, Hendersonville, Portland. There's 3 clinics in Sumner County. There's only one of 2 counties in the state that has 3 clinics. We've got West Longview in Portland, in Hendersonville on Shackle Island Road, and here in Gallatin on just off of Dobbins Pike are the 3 clinics.
Awesome. You mentioned earlier that you're doing the COVID testing every day of the week. Is that including weekends as well?
No, not weekends. Monday through Friday, 9 to 3.
Okay. Perfect. Well, something kind of fun that I've been asking all of our guests, I guess it's kind of fun, just a little off-topic question, but we know that this has kind of flipped everybody's lives upside down. And I know that especially you've been very busy all hours of the day trying to navigate all of this. And what have you done during this time to help maintain a sense of normalcy and just kind of keep on track and keep your head straight? What have you been doing in your own time?
Oh, goodness. If I can fish this time of year, that's a good relaxation for me. Get that and yard work does wonders for me. So I've enjoyed the spring. It's been a little bit different. Spent more time at work than normal. More Saturdays and more late evenings than normal, but overall, like I said earlier, I'm proud. I got 54 staff members that have stepped up and done their job, and just tickled to death that we kind of planned for this. Another program I didn't mention yet is our bioterrorism (BT) emergency preparedness. And this does fall right in line with what we train for. And part of our pod point of distribution exercises we've done, the 2 days we were at Gallatin High School, that falls right in line with that emergency preparedness. And I was tickled with how the staff turned out in our cooperation with emergency management, City of Gallatin, Sheriff's Department, Police Department. We were able to just go to Gallatin High School, and we saw 851 one day and 619 another day.
Wow.
So we highest numbers in the region around Davidson County for those two, one of those events. So I was really proud and tickled to brag on Sumner County.
I've said it, and the mayor and I have talked about it a lot. And I really think, the good thing about Gallatin and Sumner County is that we all really work well together already, and we collaborate well. And so we didn't have to figure out how to do this during this time. We just started doing it like we always do. We did have another question come in from Kara Brumley. It says, back to immunizations. New residents of Tennessee have to request their child's immunization record be transferred to the Tennessee form in order to enter preschool child care. Can that be done online or via phone so that they do not have to come in?
Yeah, again, that's at Sumner 10 at the county website.
I put it in there also.
Good. Okay, good. There's an immunization update or request, part of the frequent answered questions and drop downs. You can go on to, that's the most convenient way to do that, is complete the documentation, send that in. It automatically will email to my staff, and they can go ahead and take that and process it and call you back and tell you, here's what shots your child's going to need, or if you're all ready to your pass, ready to go. Again, this will be our third year of using that. I think we had a little over 100 the first year. We did over 200 last year. It's very easy, convenient, and you don't have to go anywhere. We'll mail you that copy back, and you'll be able to present that when you get ready to go to register for school.
Thank you. I know we've gotten a few calls at the chamber since my time here about birth certificates, death certificates, and just so everybody knows that's watching, if you didn't know, you get those from the health department. Am I right? If you need additional copies.
I laugh and say we take care of you from womb to tomb. So your birth certificate to your death certificate and a little bit of everything in between.
Perfect. And if somebody needs one of those, we know we've got a lot of new folks relocating to the area. If they were maybe born in a different county or even state, do they work with y'all, or do they call their home state, home county?
If they're born outside of the state of Tennessee or born prior to 64, they would go to their home state, or there's a long form at the tn.gov vital records website for them to complete. The gold star that is now required on the driver license for travel and all. I believe that it may have extended that out a little further. Well, we've seen a lot of people coming in needing a certified birth certificate in order to get those forms. And we're still seeing those people at all three of the clinics daily to come in and get that done and completed. Those birth certificates are $15. People are encouraged anytime to come on by the health department, complete that the paperwork, and they're good to go.
Awesome. Thank you. We just had another question come in about the CDC guidelines about reopening schools, and we already talked about that towards the beginning of the video. And so you could go back and watch when we wrap up and see what we had to say about that. So Hal, do you have anything you'd like to add about just what y'all do, or about these times, or just anything you think would be good for the community to hear?
We're starting to open back up and get back to somewhat normal life. But again, keep your mask, wear your mask, protect those that are vulnerable, keep social distancing. We worked with y'all weeks ago with the chambers across the county on the Stay Home Sumner. We're in between. We're not ready we're completely stay home, but we should just say stay safe Sumner now instead of stay home. But again, be aware of your surroundings and keep the social distancing, washing your hands, wearing your mask, and at least for the time period right now. So we're protecting yourself and protecting others.
I think that's good advice, and I think the Stay Safe Sumner is a very good message during these times. Hal, I really appreciate you coming on and being our guest today, and I so appreciate everything you and your team do all the time, but especially during these times. I know it's been challenging, and I know it's been longer hours, and we appreciate your commitment to the community, Gallatin and Sumner County. So thank you for that.
And just have people, if they need questions or information, my number, feel free to talk to any of my staff, and we'll be happy to help.
Awesome. And he's got a great team, and they are always willing and able to answer questions you have when you call. That about wraps us up for today. We will be back on Tuesday at 10 a.m. live on Facebook again. On Tuesday, we'll have a special guest, Brad Singleton with Briar Scratch Brewing, and owner of a couple of restaurants here in town, talking about the impact it has had on the beer industry and also the food industry during this time. So we will see you again on Tuesday at 10. Have a great weekend. Bye. Sorry.